the first couple times that you're around it, because it's a new experience to you, and you feel that people should treat that kind of situation with a lot of respect, the way that you would. But the more that you are exposed to it, the more it becomes a common occurrence, I suppose, and the intensity of it kind of just flows out.
Well, everybody deals with it in a different way, and you know, it's really not what you expect, and it's different every time. It's different for every patient, different for every family member. Some people are relieved when it happens, and some people just don't know how to deal with it yet, so they make jokes.
If you're joking with coworkers, I don't think that's necessarily such a bad thing. If it's just something you all are doing to kind of help cope or move on, you definitely wouldn't want to do it in front of the person's family or with that person if they're on their deathbed, joking with them about their own death, unless they start it, because I know people that have done that. But as a coping mechanism among employees, I think it's an okay thing as long as you realize that, you know, it is a kind of a coping mechanism and people just aren't full of hate.
Everybody's got their own coping mechanisms, and if that's how they deal with it, then I don't see any problem with it, as long as it's not hurting anybody.
I've never really been afraid of dead people because my dad, like I said, worked in a cemetery, so I got over the fear of dead people early in my life. My dad's saying it was, and always is, it isn't the dead people you should be worried about, it's the ones that are still up walking around you should be worried about.
The first time I was ever exposed to death, I was actually 5 years old. My grandpa had shot himself in the head on Christmas Eve when I was 5. And I heard it, I got out of my house, because we actually only lived like 10 yards apart at that time, me and my family and my father's parents. And I went out and I walked across the yard, saw it, and sat there, tried to shake him, tried to wake him up. He didn't wake up. I called 911. Then I woke up the rest of the family, and it was a really bad ordeal. But it kind of put the standard. To me, death is not something that's scary. It's not intimidating. There is ways to work around it. There's ways to help people and help people who are going through other people's loss. So it's just a form of moving on, I think.
If you don't laugh about it, you probably wind up being all depressed and crying all the time. Because, you know, that's going to be us one day.
Yeah, I always tell people that after working in a hospital, I want to die young, and a freak kind of Thelma and Louise thing where I just get in a car, drive across the country, and end up in a shootout or something like that, because I don't want to be taken care of quite like that the rest of my life.
Death is so serious anyway that it helps to make light, because I know that if something happens to me, I hope someone at least doesn't take it that serious. Yeah, I'm dead, but you know, there's got to be something funny about it.
Maybe I should start smoking.
And it's a really fine line, and you have to be with certain people to be able to respect that kind of humor. Like, people on the ambulance have their certain type of humor, but there's also people on it who are, I don't want anyone to take this offensively, but Christian folk who don't find people suffering amusing. They're the ones who just bottle everything up, and it just slowly degrades them. They're the ones who burn out in like 3 years. But if you don't joke about it, if you don't find something funny, then you'll kind of burn out really quickly.
Everybody dies. Most everybody grows old. And a lot of people get dementia in their later years. You know, you dwell on it, you go crazy. It's just your most hilarious time of life. You're making other people laugh. And you don't care because you don't know what's going on.
But there's been many instances where just you walk into a patient's room, usually the demented ones that don't know where they are, and you'll just find that they've had a bowel movement, but even though they're wearing a Depends diaper or anything like that, it's managed to not only escape the diaper, but it's managed to get onto their hands, onto the bed, onto the floor. I've seen a couple instances in the ceiling, and the walls kind of look like the Blair Witch Project in the last scene where the handprints are all over the wall. And this usually happens probably at the worst time. You know, you still have 8 other patients you have to get out and either give baths to or do, you know, a number of different things. And then just last month there was another patient like this, you know, poop on hands and everything. I mean, we're trying to clean him up. He didn't want us to be there, so he started scratching everybody. And he had poopy, scratchy nails and getting into everybody's skin. And that's just great when you walk home at the end of the day and you know that no part of you is clean, no matter how many times you wash, and that you are possibly going to get deeply infected by fecal cuts.
No part of you is clean, no matter how many times you wash. That pretty much sums up what it feels like to do this job. When death and suffering become a part of your daily grind, you stop taking them seriously. All the diseases that you're supposed to be afraid of stop scaring you, and the simple act of giving a shit about your own health becomes too much of a hassle. And your own approaching death becomes one more depressing chore that you'll have to take care of eventually, like a sink full of dirty dishes or a pile of dog shit on the rug. And that's just how it is working in general medicine. I cannot begin to imagine what it must be like for a combat medic in the middle of Iraq, or a doctor in the worst part of Darfur. Those guys must have some demons. And if they still have a sense of humor, it'll be off the fucking charts. Whatever level of medicine you work at, you have to find some way to keep from being paralyzed by the ugly parts of your job. It seems to come down to a simple choice between laughing about it or crying about it. Either one goes good with the drug of your choice. When I die, when my corpse is laid out on my nice clean hospital bed, I hope that all my friends and family gather round. I hope that they are somber and respectful. I hope that they remember the good things I did in my life. And then I hope someone nudges the person next to them and says, "Hey, is it just me, or does he have a heart on?"
My name's Angela Baldwin, and I'm an RN at Boone Hospital and General Medical.
I'm Barb, and I'm a patient care technician at Boone Hospital.
My name is Chris Harvey. I used to be a EMT on an ambulance.
My name is Linda Ritchie, and I'm an RN at Boone Hospital.
My name is Mike Rouse, and I'm a patient care technician at Boone Hospital.